Dr. Nola Pender is a retired professor from the University of Michigan. She was honored by the university with the title Professor Emerita due to the distinguished contributions she offered the academy. She's been a nurse educator for over 40 years. She's taught bachelorette, master's, and PhD students and also mentored a number of postdoctorals. During research, reading about Nola Pender, I found a quote that sparked my interest. She credits Dr. James Hall with introducing her to considerations of how people think and how a person's thoughts motivate behavior. I think this is when the wheels really started turning, and she began working on the health promotion model. This model helps nurses understand what determines health behaviors and what variables impact those behaviors. The health promotion model was designed as a way to prevent acute and chronic illnesses by promoting a healthy lifestyle. The hopes would be that it would save financially by decreasing the amount of hospital visits. She focused more on positive motivation rather than negative motivation. Dr. Nola Pender first proposed this health promotion model in 1982, and it was revised in 1996. As you can see here, we have a nice diagram on the right to help visualize the health promotion model. Dr. Nola Pender noticed that often care was initiated after an illness. People with high blood pressure, diabetes, heart disease, things like that were being managed after being diagnosed. She found that it would be more important to focus on prevention so that we wouldn't have to spend the money to take care of people after they were sick. She focuses on a positive outlook, things that we can change. The model also takes into account prior behaviors and personal factors using things like perceived benefits and barriers. It allows for life demands and different levels of commitment. The greatest thing about the health promotion model is that the plan can be personalized. The health promotion model does make a couple of assumptions. 1, people want to regulate their own behavior. 2, people interact with the environment, transforming it as well as themselves. 3, health professionals are part of the interpersonal environment which influences people. 4, self-initiated change of the person or environment is key to behavior modification. If you encounter an apathetic person, you might have trouble with this model. The patient must cooperate and be willing to change. Perceived benefits, unfortunately, are often more important after a diagnosis has been made. A young girl recently came into the emergency department in diabetic ketoacidosis. She didn't even know that she was diabetic. Had she had the proper preventative care, she may never have reached this point. Just as care for ourselves can prevent problems in the long run, women who care for themselves during pregnancy can help prevent problems with their children. As great as the health promotion model sounds on paper, there are some limitations. This model relies heavily on patients' values and their perception of control. If you don't feel like you can control something, then you wouldn't even start. It's all about taking small steps and learning how to form new habits. However, sometimes, even if the desire is there are situational or environmental barriers. This model requires the ability to reflect on behavior and create change in patterns. The health promotion model has shown to be effective in research. One study showed that it improved the nutritional behavior of overweight and obese women. Imagine the money that could be saved if we were only able to prevent the illnesses out there, rather than taking care of them once they had been diagnosed. We should have programs utilizing mass media to inform the public about healthy nutritional behaviors and disease prevention.